Let's talk about this study. So based on this study, the FDA approved the use of escitalopram down to age 7 for generalized anxiety disorder. I'm Dr. Willow, I'm board certified psychiatrist and a pharmacist, so I know my medications. Let's talk about what the study did though. So 138 patients aged 7 to 17 were enrolled. It was only an 8-week study though, and those of you know that kids are usually on these medications longer than 8 weeks. In the 8 weeks, however, they did find a clinically significant decrease in anxiety symptoms, and they didn't see that there was a big difference in adverse events between the placebo group and the non-placebo group. That's positive. What did I find really interesting though? So the dosing of the study, they used dosing of escitalopram from 10 to 20 milligrams. Now, those of you who work with kids might know that a lot of kids could actually get started on 5 milligrams of escitalopram. And this shows that you've got to have them at the 10 to 20 for the benefit for the anxiety. Okay, so what else and why is this relevant is that before we really were using fluoxetine or Prozac. Now, it can be a great medication, but fluoxetine has a lot of drug interactions. It interacts with other medications, which isn't always practical for kids who are on other medications. And sometimes the side effect profile can make it a little bit more difficult to tolerate. So this is great that we now have another option to use for children down to age 7.